everyone. My name is Gabby Jimenez. I'm a health promotion specialist at the Pueblo Department of Public Health and Environment, our local health department here in Pueblo. If you're not familiar, we have a little bit of a long name, so sometimes when I say that, people are like, what is that? So it's our health department. We have a few people in person, and then we are also casting virtually on Zoom. So before we dive in, is anyone already familiar with the term family friendly? Do you know what that means? You can give me a head nod or no. Kind of? Okay, very good. So what it means to be a family friendly employer. It just means that you have policies, hopefully in the following areas. These eight components is what we focus on. So we'll get into some different examples and things like that. But just as a starter, that's what it means to be family friendly, is to hopefully have policies in these areas. Okay, so quick overview of what we'll talk about. We will discuss the benefits of a family friendly workplace, the types and examples of the policies, and then what it takes to get started on becoming a family friendly employer. Okay, so first off, just some data behind family-friendly workplace policies and what they help with. They help with a number of things. This is just a few, but they do help employers recruit new employees if they need new people. It helps them retain the current employees that they have and hopefully decrease those turnover rates, because we're seeing that's very, very common this day and age. People leave jobs all the time. It's very, very common. You don't usually see people staying in a job for 20, 30 years as much anymore. So these policies help increase productivity in the workplace because they contribute to employees being happier and healthier overall if they have all of their needs met. And with that, it does help improve employee loyalty and commitment so that they, stay motivated and focused to get the job done right, and of course to take care of their health needs at home as well. So some reasons why these policies are good for employees and their families. There's a variety of reasons, but there's just a few listed here. So again, for employees, it helps boost their morale, right? It helps improve their focus, their loyalty, their commitment to their job and the employer that they work for. It helps reduce those stress levels because if they have things like a flexible work schedule, let's say, or remote work, if that's an option, or even partial remote work, all of those types of policies do help contribute to an employee's work-life balance with their family. So when it comes to the family, these policies actually reduce things like infant mortality rates, which is really interesting because family-friendly policies contribute to longer duration of breastfeeding rates, for example, when you have a baby. Because again, it provides that flexibility that employees need with having to, pump at work to continue breastfeeding their child. Also, it just reduces overall household stress, again, because having the benefits in place that you need with comprehensive health care, paid time off, flexibility in scheduling, a variety of policies, right? All of those things contribute to overall household stress levels and maintaining a good work-life balance. Okay, so now some reasons why these policies are really great for the employer. Again, variety of reasons, but here's just a few. So these policies, as I mentioned before, they do help decrease the rates of turnover and absenteeism because again, if people have what they need, right, for their health, their family's health, they're gonna just be more motivated to get to work. They're gonna stay healthier to get to work. And again, it does increase, their productivity. It does promote workplace equity because if there's a variety of policies that are being offered benefit-wise, then that's going to help everyone in some shape or form, whether you need the healthcare benefits or you need a remote work day, if that's an option, or if you need, let's say, a modified schedule, because sometimes for people, the standard Monday through Friday, 8 to 5, doesn't always work for everyone's schedule these days, especially after the pandemic. We've seen, the pandemic really changed everything. And of course, everything went to Zoom, became very virtual. And then employers also started implementing modified schedules. So whether that's, working 4 10s and having an extra day off, or working some other type of modified schedule. And of course, these policies, they do increase the value on investment and return on investment, right? Because of all the reasons we just talked about with how these policies are good for employees and their families. Okay, so now we will get into some examples of employers in Pueblo that have implemented these types of policies. Some of these are businesses that I've worked with, and some are just general examples. So for comprehensive health benefits, the health department actually offers an exceptional benefits package, including para-retirement, health, dental, vision insurance, and an option for a health savings account. And we actually do have very good insurance coverage there with United Healthcare. So just one example for that. For paid leave, Chavez Huerta K-12 Preparatory Academy, they have a very good paid time off policy for their employees when there's a need, a death in their family, a baby's born, or there's other emergencies that happen. An employee can accumulate up to 240 hours per fiscal year, which is a pretty good average, is what I've seen with what businesses and employers can offer for paid time off. Now for caregiving responsibilities, there's some different policies under this component, but one of them being childcare. So Colorado State University Pueblo, they have a really great childcare center for their students and staff. That one, they can take kiddos from 12 months up to 6 years of age, which is really great because I know a lot of students on campus rely on the childcare center so they can continue school, and some of the staff as well definitely depend on that. It's not listed here, but another example of caregiving responsibilities and what those policies look like is if employers offer any type of policy to help with elders. So some employers may have a program where they have some type of healthcare assistance for elderly. That's not as common, but that's another example. For flexibility, this, like I talked about earlier, would mean a remote work policy or just a modified work schedule. So NeighborWorks here in town, they do offer this, and their staff can work really any type of modified schedule outside of the standard Monday through Friday 8 to 5. They can do 4 10s to have 3 days off. They can do 4 9-hour days and 1 half day. So Monday through Thursday, work 9 hours, half day Friday, get off early and have a little bit longer of a weekend. The health department also does this, which is really, really nice. They offer modified work schedules. So many of us work 4 10-hour days, including myself. So then I have an extra day off at home with my family. Some people do the 4 9s and a 4. I did that for a very long time, and it was always really nice too. There's some other variations, but those are the common ones that we have at the health department. For community involvement, these policies usually are if a employer offers some type of volunteer work program for their staff. So they'll allow their staff to do some volunteer work of their choice somewhere in the community, whether that's at, the animal shelter, the soup kitchen, things like that. So Kohl's, for it being such a big corporation, it's interesting. They actually have a volunteer program. And this one, I don't know exactly how many hours they allot to staff on a quarterly basis, but it is interesting how, again, they're a pretty big corporation. You don't always see that with larger entities. You see these types of policies with smaller local businesses. For career development, these types of policies is trainings that are offered, conferences that you can go to, anything really that's going to help staff learn more about the work they're doing and hopefully advance in their career. So, and another example too is different employers might offer some type of assistance, with tuition reimbursement. So this is one of them where Catholic Charities, they offer $250 per semester for their staff attending school. So it's not a ton, but it's something, and anything helps, right? Because school is super expensive, unfortunately. For supportive and inclusive services, this one also has some different policies under it, but one of the ones that's the most common is employers implementing lactation policies, as I was mentioning earlier about the breastfeeding duration rates. This is very common where employers are implementing a lactation policy so that working mothers can go back to work and then still lactate at work and pump for their baby. So an example of this is PCC. I actually had the pleasure of working with them a couple years back when we had a different program at the health department that was called our Breastfeeding Friendly Worksite Wellness Program. And it it allowed for us to work with businesses on creating lactation policies, implementing them, and then also helping them develop a lactation space if they had the space already. Let's say it was a random office that wasn't being used or some type of storage area that wasn't being used. Those were the rooms where we actually bought the furniture for them, the decorations if they needed them, mini fridges. I'm trying to think of other things, but you get the idea where we were able to help them create this space that, not everywhere has that. So it was really great working with them on creating a policy, implementing that, and then creating a wonderful lactation space that they still use. They have for both their staff and their students. So if you ever happen to be at PCC and want to see that, definitely check it out. It's a really nice space. Um, Same thing, it's not listed here, but another example of this is at the Pueblo Mall. If you ever go to the mall and you see the lactation pod there over by Dillard's, that was the last thing that I got to do for our community, which was huge. At the end of that program, I was able to purchase that pod with our grant funds from the program and basically just give that to the mall. So it's there for the community, which is really cool because those pods are quite expensive for one, and they're not as common, at least in southern Colorado. You might see them in Denver or other big cities, but down here our way you don't see those as much. So those are really a big deal being able to do that. And so now, after you've learned what it means to be family friendly, the types of policies that we work on, if you're interested in becoming a family friendly employer, or at least if you're interested in adding to what you already do, because you may already have some really great policies in place, you can work with me on a brief assessment survey that I have here. And I will give this out to those in person, and also I can provide this via email. But what we start with is you completing this assessment survey that just gives me some background information about business or entity that you work for. I learn about what type of staff are already employed there. So demographics, what type of population we're working with, how many staff are employed, is it mostly female, male? And then this also gives me a better idea of where you currently stand with your policies. So what you already have in place, what you don't, or what you may be interested in working on with me, because I can help you write these policies. That is our main goal. And so if we do work on policy changes together, then you can also earn some incentive items, which is really great. We actually have a couple here today. So some examples is you would get a $50 Visa gift card just for completing the survey. And then if we work on policy changes together, you can earn additional gift cards up to $300. Or some other fun amenities for the workplace is we offer Keurigs, popcorn machines, and some exercise equipment as well. So there is some goodies that you get for participating. It's not all for nothing, of course. But the more businesses that we can work with in the community, the better, because we want to make Pueblo County family friendly as a whole. So that is pretty much everything that I have for you all today. Does anyone have any questions for me? What size of companies do you work with? I mean, how small? Yeah, great question. So typically, our goal is to work with small, locally owned, Latino owned, woman owned businesses, but we're also open to working with anyone else that's interested. That's just our main target right now. But great question. Thank you very much. Well, like I said, that's all I have, unless there's any other questions. I don't see any. Okay. All right. Thank you. Oh, one more thing before I forget. Yes, thank you, Melinda. I knew I was going to probably forget. So this is my coworker, Melinda. Yes.
Hi, everyone. I'm Melinda Sentence. I also work for the health department with Gabby, not in her program, in a different program. So the program that I do, I provide Narcan training to businesses within the community. How many of you guys have heard of Narcan dash naloxone before? Okay, so Narcan is a medication that reverses an opiate overdose. Unfortunately, Pueblo County is experiencing overdoses here. And so one way to prevent people from dying from an opiate overdose is to have Narcan on hand. Narcan should be on hand in every business. It's kind of like having a fire extinguisher, a first aid kit, and an EpiPen on hand. We want to have those on hand, but we hope that we never have to use those. An opiate overdose can happen to anybody who has taken an opiate. That means grandma, the mother, the son, the daughter, anybody who's really prescribed an opiate can experience an opiate overdose. So it's really critical that we provide it to our community to prevent opiate overdoses from occurring. So with that being said, I provide the training. I also provide the Narcan. Narcan is an expensive medication. There is a copay if you have insurance, but we at the health department, we have access to a bulk fund, so we get actually that medication for free. So if you're interested in becoming Narcan trained and have it at your business, um, email Gabby and I will come out, we'll figure out a good time. It takes about 10 minutes to be trained. There are two laws in place here in Colorado, actually in the United States, but Colorado specific, that protect us from getting sued. So we can administer Narcan even if in doubt, right? Because all Narcan does, it takes away that opiate from that opiate brain receptor and it allows a person to breathe again. It is not a substitute for emergency medical care. We still have to call 911, but it's kind of like when we see an accident on the road, we want to be out there to help. And that is the other law that protects us. It's the 911 Good Samaritan law. And then the third party naloxone law, which allows us as non-medical professionals to administer that medication if we're believing that this person is experiencing overdose. Again, I would give that out for free. And if you're interested, just contact Gabby. Gabby will let me know, and I'll figure out a good time and date and get you all trained. So, thank you.
Thank you.